safety at work, hospital. Table of contents. Hand hygiene and blood spills and personal protective equipment. Blood spills and exposures. Sharps safety. Standard precautions. Emergency codes. Red rules. Safe Medical Devices Act are things that will be covered in Safety at Work, Hospital Edition. Hand health and blood spills, personal protective equipment. 6 moments for hand hygiene. 1. Before touching the patient. 2. Before clean and aseptic procedure. 3. After body fluid exposure risk. 4. After touching a patient. 5. After touching the patient's surroundings. 6. Entering and or exiting the patient's room. When handling blood or other potentially infectious materials, and any time there is a risk of a splash, you must use the following personal protective equipment. Gloves when handling blood or other potentially infectious materials or non-intact skin. Gowns when there is a risk of splash of blood or OPIM to clothing. Mask and goggles, both or face shields when blood or OPIM could splash in your face. Note, make sure you know where to find these items and how to properly use all PPE. Blood spills and exposures. To clean a blood spill, put on gloves and other PPE appropriate to the size of the spill. Contain the spill, spray the area with an approved disinfectant, and wipe clean. If you are exposed to blood or other body fluids, immediately wash the exposed skin with soap and water or flush mucous membranes with water or saline. Report to employee health, the administrative coordinator, or infection control liaison at off-site locations. Finally, complete an employee incident report in your safety zone portals. Sharp safety. Sharp safety devices are for your protection, and by law, you must use them. Sharps should never be thrown away in anything other than a sharps disposal box. Examples of sharp safety devices are intramuscular and subcutaneous needles and syringes, needleless IV tubing sets, safety lancets, phlebotomy devices, and IV safety catheters. Standard precautions. In addition to hand hygiene, PPE, and safe injection practices, other elements of standard precautions include care and cleanliness of all healthcare facilities, cough etiquette and respiratory hygiene, safe handling of laundry, patient isolation and transportation, handling of dirty patient care equipment, instruments, and devices. Emergency codes. Code red, fire. Code orange, chemical spill. Code yellow, bomb threat. Code pink, infant, child, abduction. Code triage, disaster. Code gray, restricted access. Code black, bioterrorism. Red rules, frequent safety rounds. Red rules are requirements that must be followed each and every time the occasion or situation arises, as such follows. A timeout completed before all invasive procedures with surgeries, or in the case of aseptic techniques. All inpatients receiving medication or blood products or undergoing any procedure will have an identification band in place, and the identification must be confirmed. Refrigerators clean and defrost regularly. Temperature checks logged at least daily. Portable patient care equipment must be cleaned and have a green clean sticker. Broken patient care equipment, place a broken tag on patient care equipment and call for the equipment to be removed and repaired. Safe Medical Devices Act. Incidents are reportable if they 1. Require surgery or medical intervention. 2. Result in permanent impairment of a body function. 3. Permanent damage of a body structure. Thank you.